Hello, everybody. Welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me today is Dr. Hope Argenziano. Thank you very much, Doctor, for coming in and talking with us today. I appreciate it.
My pleasure.
And like I said, I was practicing your last name all day today because that one thing I never want to do is screw them up.
No, you did perfect.
Oh, thank you very much. You are a rheumatology specialist at Monument Health. Is that what you're called, or are you a rheumatology doctor? I mean, in essence.
Rheumatologist.
Okay, rheumatologist. Mm-hmm. All right, that makes sense. That's a great place to start with this podcast because that's a word some of us hear, and unless you are diagnosed with a condition that might have that word in it, what does it mean? Where does it come from?
Oh, that's a great question. So back in the days, like back in the 1920s, even dating back to the late 1800s, they used to tell people that they had rheumatism. So it just meant you hurt and you ached, and they kind of didn't know why. So even, some of great-great-grandparents or grandparents, they said, oh, I have rheumatism. And so it just kind of meant rheumatic diseases are from joints and pain. So that's where that comes from. But as we've grown in the field, it's more than just pain. We're not pain doctors. We deal with when the immune system gets confused and it starts to attack our body by mistake.
Okay. All right. I can't wait to get into that. But first, if I could get a little background on you, Doctor. Where were you born and raised? Because you weren't from here, right?
No. I was actually born and raised in Colorado, Trinidad. Okay. Which is known for certain things, but I would say grew up there, and then went right into the military, and I was in the Air Force for 6 years. I was
excellent.
in fuels, and then I ended up, unfortunately, getting really sick, and nobody knew what was going on, and I could barely really move. I couldn't do my job anymore, and it turns out that I had lupus. So I was medically discharged. That was kind of sad because I really loved what I did.
Yeah.
And then after that, I didn't really know what my path was. And then my doctor, Dr. Lessard, he was my rheumatologist, and he said, "Oh, you should come to here to Grand Forks and replace me because I want to retire." So 14 years later, I ended up finishing off my school and went to Grand Forks and was their rheumatologist for about 8 years. And then the weather got cold, and then I had always heard about Cindy Weaver, who is the other rheumatologist, just good things. And I took a year off, and they said, would you consider coming to practice at Monument Health? And I was like, with Cindy, absolutely, absolutely.
So while you were in the military, you didn't think that this would end up your path?
No. I wanted to retire from the military. I just loved what I did. Mm-hmm.
Well, I think you're the first doctor I've talked to that specialty is a condition that you actually have, which has to be kind of interesting, really.
It is. I think that part of it is when people are trying to describe what they feel, a lot of times their symptoms with pain and fatigue and just some of the other weird things that happen when your immune system has gone awry. A lot of people think, am I going crazy? Because a lot of times the symptoms don't manifest right away, and so it can take years. Like my lupus, it took 2 years to diagnose. And I remember that. It took 2 years because when I was first sick, it looked like everything was wrong. It looked like I had many autoimmune diseases because all the tests were off the charts. And I just started treatment, had faith in my doctors, and after that, it just manifested and whittled its way down to this is lupus.
Okay. Well, I know we're going to do an entire podcast about that topic later. Today, I definitely want to focus on rheumatoid arthritis. But before we get into any of that, Doctor, let's talk about the immune system, for starters. Why does it hate us sometimes?
And it doesn't. So the immune system is amazing.
Yeah.
And, unfortunately, we only know a small amount. It's one of those parts of our body where we just keep learning more and more. And, just when we think we know something, it turns out that, we've barely scratched the surface. So our immune system, our immune system is made to protect us. when our immune system is created, it has to go through an education. It has to decide what is us and what is foreign, a foreign invader, like a virus or a bacteria. So it's like this little army going through training. And overall, at the end of that education, it should know what is us and not to attack it. So when a person is born with a predisposition to rheumatoid arthritis, there's something in their DNA that says might have rheumatoid arthritis, but we're not born with our immune system attacking ourselves. So it takes something in the environment like a viral infection or high stress, or in some women, it's after the birth of a child that has activated the immune system into a point where it gets confused. So people think, well, I have an autoimmune disease, that there's something wrong with my immune system. It's overactive or it's underactive. It's actually a perfectly normal, healthy immune system. It's just attacking us when it shouldn't. So that education that it had is out the door. So for rheumatoid arthritis, it starts to sense certain joints as a virus. And it said, come on, guys, let's go and let's start creating all this inflammation to get rid of these viruses when it's actually our joints.
So does it only affect, is rheumatoid arthritis only a joint issue with our body generally? Or, I mean, I would assume it maybe gets more complicated than that.
Sure. So generally nowadays it is. It usually starts with the small joints, and in this row called the MCPs and this row called the PIPs.
And you're pointing to your finger, your knuckles, right?
Correct.
In that area? Okay.
Yep, and it always is bilateral, so it'll affect both sides of the body. And then if it's undiagnosed or it starts to get worse, then it can start to attack the larger joints. But hands and feet are usually where it starts, but everybody's different. But back in the days when we didn't have any medications for rheumatoid arthritis, we used to inject people with gold back in the day, real gold shots. And we used to give them like maybe 12 or 13 aspirin a day. So that's all we knew. And I remember my mentor, he would have just injection joint days. They didn't have any medicine, so people would just line up and he would get cortisone and just inject the joints that hurt. And it was like, next, give them joint injections.
Just down the
next.
line.
Yeah.
What was the science behind the gold? Do you know?
That I don't know. You would have to ask my partner,
Boy,
Cindy.
Boy, that's strange.
Yes, that and honestly, I think that within 20 or 30 years, the people after us are going to be like, you did what?
Right.
You were giving people what?
Exactly.
Yeah.
So what is, I mean, this kind of ties into this question. What are some like common early symptoms? You mentioned mainly in the hands, like along your knuckles there. What is it? Are those generally where, like you say, that's kind of generally where it pops up before you catch it? Mm-hmm. Can you describe, how does it feel? What does it feel like when you have something like that?
With that, it feels over initially like a tightness in your hands and a stiffness, almost like, it's hard to make a fist. Just think of, for example, our joint is in a capsule, and inside that capsule is lubrication for our joints to bend. But imagine a balloon that is filled to a certain amount, and then it starts getting larger and larger. And that's when what happens is there's inflammation in that joint, but it keeps filling up to expand the joint. And that's what you see as swelling, but it feels tight, and at some point it starts becoming very painful.
Okay, so it is, you will sense it. I mean, you'll know something's wrong in your hands by
right.
what you've described for sure.
And initially, a lot of people tell me they just feel like they're the Tin Man, just very stiff, but then the pain starts.
Okay, so then how do you guys diagnose something like this? What are the tests that are typically involved?
That's a great question. So I would say most people think that it's a blood test. Our tests are not like pregnancy tests where if it's positive, you have that condition. Our tests, we're doing the best that we can, but they're not always accurate. So there are two tests for rheumatoid arthritis called a rheumatoid factor and a CCP protein. Rheumatoid factor is an older test, but it can be seen in other conditions. It can be seen positive in people who have a current infection, or if they have other autoimmune diseases, or if they have some type of cancer or malignancy. So we have to take that one with a grain of salt. The CCP protein is a somewhat newer test, and that overall is more accurate. It's usually only seen in rheumatoid.
So then once you have it diagnosed, and you guys are pretty confident that's what it is, it seems like any immune issue you have, there's no cures for this kind of stuff, is there?
That is correct, because honestly, we would have to make up a cure for every single person, because every single person has a different immune system. Your immune system is an accumulation of everything that you've encountered throughout your life and how your immune system has reacted to it.
Wow. So that is, I mean, it would really be a magic bullet then to find something like that for sure.
It would. I mean, we do have targeted therapy now, but we're kind of guessing as to what certain protein or molecule your immune system is using to cause the inflammation.
I see. So then you mentioned a little bit of the things you can do to treat it, but what treatment options are available for managing stuff like this, and how effective are they?
Sure. And I would say over the years we've come a long way. Great therapies. There are some medicines that target the entire immune system, like prednisone. We've had that for a long time now. The only thing with that is there's such bad long-term side effects. If there were not side effects from prednisone, it would basically be the best medicine we have.
Really?
Because remember what I said is that we don't know which molecule or cytokine is the technical term your immune system is using to create the inflammation. So what we do with the prednisone, it almost carpet bombs the entire immune system. It takes the entire immune system and it suppresses it a lot. So we're going to hit our target with that.
Yeah. So what are the side effects of it, though? What makes it so miserable to be on?
Well, prednisone overall, it's basically a form of cortisol that we produce as a hormone in our body. So if people are exposed to large amounts for a large amount of time, they gain a lot of weight. They can get what's called cushingoid features, which is very chubby face. They can get fat deposits around their abdomen and their back. They can start to lose bone density. It's called osteoporosis, and get fractures. The list goes on and on. They can become dependent on it if they're on it for long, long periods of time, to where their adrenal glands that normally make it shut down and they don't want to make the cortisol anymore, and so we have to continue to give them the pills even if they don't need it for their arthritis.
Oh boy, it's that must be frustrating as a doctor. You're that close to something that can work, but those side effects are.
They actually were going to give the doctor at the Mayo Clinic who created prednisone the Nobel Prize for curing rheumatoid arthritis until they found out it wasn't technically a cure, because when the patients stopped it, their symptoms came back, but just due to all the side effects as well.
Oh man. Now, is this? I read a little bit before you came in today that with rheumatoid arthritis, it's a condition, like you said, if it kind of starts in your hands. If you catch it early enough, though, can it keep from spreading to some of these other joints too, like you said?
Yeah, and I think that getting the diagnosis early on is crucial. So if a person has inflammation called synovitis in their joints, if it sits there for about 2 years, that's when it starts to erode the bone, meaning it's almost like a little mouse eating away at the bones. And then after 2 years, we tend to see changes on X-ray. They're called erosions. Just like soil erodes with weather, with the inflammation, the bone starts to erode. And that's damage that we can't come back from. So if we start patients on medicine early, they're called oral DMARDs, or disease-modifying agents. What that means is that they help prevent damage.
Now, a question I probably should have asked before we got into a lot of this. How is rheumatoid arthritis just different from other types of arthritis? What's the distinction there?
Right. And so we're all going to get arthritis at some point.
Right.
Just because our bodies, like say if you're a runner and you love to run, well, you're probably going to end up with what we term is wear and tear arthritis. The technical term is osteoarthritis.
Okay.
But the best way to explain it is that overall, if you're running, your joints, they do have some trauma to it. But our bone is amazing. It kind of senses that there's been damage. So what it will do is the bone will start laying down overall more bone to repair this damage, and then you end up with all this jagged, irregular bone called a bone spur. And so when we get wear and tear arthritis, our joints usually become misshapen with all of this extra bone that shouldn't be there, and then it can't function as a good joint anymore, and that's why people eventually need like knee replacements or hip replacements. That overall is just living a very active life. It's unfortunate, it hurts, but it's just kind of, our bodies were not built to live 100 years.
Right. Well, that's a good point. It's a point you don't like to hear because you're hoping that you can. And it almost seems like your body's trying its best to protect itself, but then it goes too far.
Exactly.
And it doesn't understand at some point, I suppose. But are there lifestyle changes you can make to help with rheumatoid arthritis, or is it something that if it's in you, it's going to happen, sort of a deal? Or is there anything you can do to prevent it, lifestyle-wise?
Right. And there are people with genetic predispositions to certain diseases that never have these, And I would say overall, healthy diet and not smoking cigarettes, that's a huge one. We wish we could put on the packages of cigarettes that can cause rheumatoid because it just activates your immune system. And your immune system, it doesn't know what to do with the carcinogens in tobacco, so it just becomes activated, and that can predispose you to things like rheumatoid. But eating healthy, staying away from a lot of the processed foods, staying away from a lot of the high fructose corn syrup. That stuff is not good. And it's in everything we eat, and it tastes so good.
Exactly. Oh, it does. So are there, I know you've said that it could, because it's your immune system, it's very challenging to address this. But we live in an age right now where the technologies that keep advancing so fast. Is there anything in research or treatments for you that you're excited about, that you have seen, or maybe they're not ready yet, but there are inklings of it?
Right. And I think a lot of the focus has been with the pharmaceutical companies coming up with more options for patients. So with all medicines, even vitamins can have side effects.
Yeah.
So even if I find out that a medicine is helping a person, well, I just saw somebody today and the medicine was helping her, but she broke out into a rash. Oh. So we have to kind of put that in the garbage can and move on to the next one. So I think there's been a lot of advances with the biologic medicines, which are that targeted therapy. But I think the bigger advances that I'm hoping to see in my lifetime would be to get a blood test and say, okay, we know that this cytokine called IL-6 is what's driving your inflammation, so let's put you on the IL-6 blocker. And so I'm hoping that, with our advancements that we're able to do that. We can technically do that, but it takes hundreds of thousands of dollars to do that for one person. But the thing is that with our immune system, it's smart. So say it's using a certain cytokine, IL-6, but then you put the person on the medicine, and a few months later, the immune system's like, oh, that's blocking us. Let's not use that molecule anymore, and let's use a different molecule. So, and that happens as well, where medicines just stop working, and that's because your immune system has pivoted.
Our immune system seems so intelligent and so obtuse all at the same time, in a sense, I guess. Well, this is, I think you've explained this very well, Doctor. And I think if anybody has these symptoms, for sure, I mean, the first place they should start is with their primary care doctor if they have these kind of things.
Yes, that's a good point. So, a lot of people think, well, I need to start at a rheumatologist. Unfortunately, there are not many of us in South Dakota, North Dakota. and in general across the United States. It's just a specialty that we need more. So, for example, right now I'm booking out till January.
Oh, wow.
And I think my partner, Cindy, I think she's booking out till like February or March.
And it's just the two of you here in Rapid City right now?
Right. We're going to be getting a new individual out of school in July or August. So that will be helpful, but still he's going to fill up.
Yeah.
Yeah. So, it's just one of those things where your primary care, they're in the trenches, they're the first line. So if you have joint pain, your primary cares are so intelligent. They'll be like, okay, well, what kind of joint pain? Is it mechanical, like osteoarthritis or a tendinitis? Or is it more inflammatory and autoimmune? And they will do the appropriate tests for that. And a lot of times, they're able to find out, oh, well, this is osteoarthritis. We can use joint injections or a medication or send you to physical therapy. And then you don't have to wait 6 or 7 months to see me for me to tell you, well, I can't help you because it's osteo. You have to see sports medicine or orthopedics, right?
Okay. Well, that makes sense. Dr. Hope Argenziano, thank you very much for coming in and talking about this. This has been very interesting and eye-opening, I think, for a lot of people. Remember, I mean, if you experience that stuff, just get to your primary right away, and then hopefully it won't have to see you because it's been booked out just a little bit. So, but thank you very much, Doctor, for coming in. This has been great. I appreciate it.
You're welcome.